Hey guys, so last time we talked about the abnormal morphology of the hip and how that can create that cycle of constantly damaging the labrum, right? And how the muscles have to take over to stabilize for that lack of suction seal that we typically get from the labrum. Um, so this time we're going to go over to the left side of the chart. We're going to talk more about the repetitive low load in the normal hip. So this is basically, we are repeatedly straining the ligaments of the hip through some of the motions that we do when we play sports. So my favorite example is actually looking at hockey players and the skating mechanics. So let's look at the ligaments of the hip first. So if we look at the top one here, we have this large ligament here called the iliofemoral ligament. Okay, and then this one here, which is actually fairly big as well, but it's kind of hidden, called the pubofemoral ligament. So these two ligaments actually stop the head of the femur from sliding forward out of the hip socket. They also stop movements in external rotation and abduction. Okay, so when we do those movements, those ligaments get tight and prevent us from going too far. Now, if we look at the skating stride, we look at this player's left leg. He is in abduction and external rotation, right? So we are basically putting those two ligaments, we're tightening those two ligaments, and over time, from repeatedly doing so, we will eventually stretch them and cause some changes in the ligaments where they're not as tight as they once were. So if we go back to the chart, that is exactly what this is here. Capsular ligamentous laxity of the hip is basically just what I described, where the ligaments get stretched and they're just not as tight, not able to do the job as well. So from repeatedly doing low load motions of the hip, we get this kind of laxity of the ligaments. Now, this should look familiar, but if we don't have the active stabilizers to help take over for that laxity of the hip, then we get into increased femoral head translation. So remember I said that the iliofemoral ligament actually helps prevent the head of the femur from sliding forward out of the socket. Well, because it's looser, we actually get more motion there, right? And then we get into this cycle again of more motion in the hip joint leads to it bumping into the labrum, which leads to labrum fraying and tearing. And then we lose that suction seal that we described last time, right? So with the labrum acting like the Nerf gun bullet, with that suction on the window, it does the same thing on the femur, but with the damage to the labrum, we actually lose that seal, so we don't get that stability from the labrum, and then we get back into this cycle of, without the active stabilizers, so the muscles, without them doing their taking over for the lack of stability from the passive stabilizers, we get into this cycle of labrum damage that we talked about last time. So those are two big mechanisms that are very common in cutting athletes, right? So sports like hockey, basketball, soccer, where they typically have labrum injuries. One of them is likely caused, part of it is likely caused from the repetitive load that we put on the hip, causing the ligament laxity, and then jumping into the cycle of labrum injury. The other one is from the FAI and the extra bone that we talked about in the last video, causing the labrum injury and then jumping into the cycle of repeatedly damaging that labrum. So the biggest thing for this is really working on these active stabilizers. I think that's really the key to not only preventing further damage, but preventing symptoms and just keeping athletes healthy in the game.